Good afternoon, and thank you for joining today's webinar. I'm Michelle Boardman, the Director of Social Marketing for the TA Network for Children's Behavioral Health. I'd like to welcome you to the Social Marketing Learning Community meeting today. Michael Collado and I facilitate the learning community. We hold these meetings monthly, and they're designed to support those who are undertaking social marketing work. That could be in communities, states, tribes, and territories, and includes both those with and without federal grants. We try hard to address topics that are meaningful to you in your work and welcome your suggestions for future topics. Today's webinar is the second of a series of 4, and if you missed the first one or you've had a busy month since you've joined us last, no worries. Our speaker today will give us a brief overview of framing and its importance in social marketing before taking us on the journey through today's content. We like these sessions to be interactive, and we encourage your comments, questions, and insights. Please use the chat box on the screen to engage. You can start by typing us a note and letting us know where you're from and introducing yourself if you haven't already. Below the chat box, you'll see a spot where you can download the slides for today's presentation. And as a follow-up to today, you also receive a link with the recording of today's webinar. Please do mute your computer to minimize background noise if you haven't already. At the end of today's webinar is a link to a very brief survey, and we would appreciate your time in responding. It will pop right up, and we take your feedback very seriously, and we use it to improve these sessions and to develop new ones around topics that are of interest to you. After today's webinar, the remaining 2 in the series will be held on May 7th and June 4th. And before I introduce today's speakers, a talented member of our media team, Gary Wolnitzik, is going to show you how to join the social marketing learning community so that you can continue to engage with Michael and I, as well as your peers, around issues of relevance to social marketing in children's behavioral health. Gary?
Sure. Jen, can we go to the next slide? One more? All right, so back at the end of January, the Institute launched a new learning management system, Ideas at the Institute, and this is to build upon the existing work that the learning communities are doing in these webinars and increase the interaction between our learning community leads as well as your fellow participants in these learning communities in a more dynamic and interactive online learning way. So really we've created this digital hub where you can join various learning communities that the TA Network hosts. You can register for upcoming webinars, download resources, as well as get technical assistance from experts in the field. Next slide, please. So this is going to be a central repository for all different types of online learning. Once again, it's where we're going to start sending people to register for these upcoming webinars, as well as we have our social media feeds, and you'll be able to see the expanse of TA Network learning communities that we have available. Next slide, please. Next slide, please, Jen. Oh, thank you. Oh. So this is just a snapshot of the learning communities that we currently have up and running. We have 6 in total, and we're going to be getting the last 5 of our learning communities up and running in May. Next slide, please. And this is just a sample of some of the activities that we have available on the Social Marketing Learning Communities homepage. We do have a survey there, as Michelle mentioned. We do want your feedback on the topics and areas of interest that you want to learn more about, and so that survey is a great way for you to provide that feedback to Michelle and Michael so that they can craft the learning community to best suit your needs. We also have links for registering for upcoming webinars, as well as recordings of webinars that we've done in the past around social marketing. And we're going to be adding more content, more resources, and more activities for folks in the learning community to engage in. And you'll see that in the chat box, there's a link that you can click on that will take you to our learning management system, and you can create a profile and begin exploring all of the content that we have available for our participants in our learning communities. And I'm going to hand it over to our partners now at Frameworks to get us started.
Actually, this is Michelle again. I'm just going to take a second to introduce Jen Nichols and Jess Moyer, who are joining us from the Research, Interpretation, and Application Department at Frameworks Institute. And they will share their objectives for today's webinar and then dive right into the content. And it's truly my pleasure to introduce them to you. They are 2 very talented professionals whose work focuses on the power of framing, messaging, and translating complicated concepts into inspiring language for policymakers and the public around the important issues of our time. With that, Jen, I'll let you take it over.
Thank you so much, Michelle, and thank you, Gary. And everyone on the phone and watching your computer, thanks so much for joining us today. I know that you are really busy, and so we appreciate your willingness to join us and your interest in learning more about framing. Also, I started a little bit on moving those slides for you, Gary. Sorry. In high school, I used to, my job in theater was to raise and lower the curtains on the plays, and that talent apparently hasn't translated to how you advance slides, but I'll work on that. I hope everyone's enjoying a beautiful day. It is gorgeous here in DC, and the cherry blossoms are out. And we're really enjoying spring being here, or as I call it, Benadryl time. So I want to walk us through really quickly the learning objectives of this webinar before we jump into the content. What we're hoping to have you all leave with today is a better understanding of how people who are not experts like you, so advocates and experts, think and talk about mental health and children's mental health in particular in certain ways, but people who don't engage in the work that you engage in don't have that deep understanding. So Frameworks has done research to figure out exactly what it is and how it is that the public thinks about child mental health. So I want you to leave with an understanding of how people's assumptions and perceptions of children's mental health influence the way they understand your messages about those issues. We'll cover a couple of specific framing tools that can help you navigate some of the assumptions people bring to conversations that they have with you, or the interpretation they bring to your website, or to the brochures that you hand out, or to any conversation or story they hear about children's mental health. And then invite you to think about how some of those tools can actually improve the work that you're doing, strengthen your effectiveness in the conversations that you're having, wherever you're having them, in whatever context, with the public as you're trying to build people's understanding of the work you do, of the services available to families and communities who need those services, and to help the greater public understand why the work you do needs to be supported, needs to be recognized and strengthened and expanded. And there will be time at the end for questions and answers. My colleague Jess Moyer is here with me, and she'll be womaning the chat box as we go through the webinar. So if you have questions, please feel free to post them in the chat box. And here we go. If you were not able to join us on March 20th, the webinar that Jess gave that day is recorded and available to you on the Learning Management System. But I wanted to make sure that everyone's on the same page as we move through some of the recommendations for today. So what I've got here is just a quick summary of what it is we're talking about when we talk about framing and when we talk about what it means to be strategic in our communications choices and why that matters. So I'm going to do this. This is probably the quickest explanation of framing I've ever given. Let's see how it goes. So the first thing to remember about framing is that we all have multiple ways of thinking about social issues. And I want to give you an example of what that looks like. So if we think about early childhood development, for example, we know from our research that one dominant way the public has of thinking about early childhood development or thinking about young children is that they're basically like adults. They're just little mini adults running around, but they're more or less the same. They just need to physically grow up, and yet they share so much in common with adults that we can approach some of the challenges young children may face in the same ways we might approach challenges that adults face. At the same time, we also know that the public has big questions about what actually happens during the earliest years of life. How do brains develop? How do little kids become adults? What does that process look like? And readily acknowledges that they have no idea. Most of us are not experts in the issue and don't really have a good, strong idea of what early childhood development is, how it works, what those processes are like. We also know that people have competing and contradictory ways of thinking about how our brains work. So on the one hand, we have a really strong perception that brains can change throughout our lifetime, that we can retrain our brains. And so, the plethora of self-help books that are out there are about, how you can train your brain to have more willpower, or how you can teach yourself to be on time if you're habitually late, or all those kinds of ways of thinking about if we could just reprogram our circuitry, we could function differently. So we have access to that way of thinking about the world, but we also at the same time have a belief and a perception that everything solidifies at a young age. So by age 5 or 6, our personalities are set in stone, our genes determine our future, and those are two competing ways of thinking about how brains work and how brains develop that we have access to. So when we're thinking or reasoning about questions related to brain development or children, we can toggle either one of those, for example, and many others too that aren't represented on this slide. And then finally, some of our research shows that we have multiple ways of thinking about who's responsible for solving problems or addressing problems within children's development. So for example, we know that members of the American public believe very strongly that problems start in the home and should be solved in the home. We call that the family bubble model, where people reason that because parents are primarily or solely responsible for a child's outcomes, it is parents' responsibility to do the right thing, make the right choice, be better parents, and if something goes wrong in a child's development, it must be the parent's fault. When people are reasoning from that perspective, and that's a story that dominates our understanding of how child development works, when people are reasoning from that perspective, it limits the responsibility the rest of us have to intervene, to find solutions, to support programs and policies that can help ensure children's well-being. At the same time, in the same brains, we also have access to a way of thinking about children in which government bears some responsibility for protecting them, in which policies and programs can help shape outcomes, in which our environments matter. The challenge in any set of competing ways of thinking about an issue is that even though we have access to all of them, one of them tends to dominate over the others. And so it's important for communicators to understand that that when you're thinking about framing, understanding is frame dependent. And what that means is that as you're thinking about all the different ways that the public has of thinking about children's mental health, for example, or early childhood development, or adolescent substance use, or the issue that you're working on, it's important to remember that you as communicators are empowered to make intentional choices that can make it more likely for your audience to think in one way instead of in a different way, even though they have access to both ways of thinking about an issue. So let me give you an example of what I mean. There's a study done a few years ago by a couple of political scientists in which they asked people to, after describing crime in a certain way, they asked they measured their people's support for enforcing certain kinds of policy reforms around public safety and criminal justice. And when they described crime as a beast affecting the city, 29% of the people they surveyed supported policy reform. So the metaphor there is the idea of crime as this wild beast kind of roaming the city, causing havoc. When they chose a different metaphor to describe the problem, this time virus, so crime as a virus, they found drastically improved support for policy reform around criminal justice and public safety. So why do you think it is that these two metaphors work so differently? What are some of the associations that people might have with the word virus that they don't have with the word beast, and vice versa? If you have answers, please put them in the chat box. Anyone?
So we have one comment so far, health is relatable.
Okay, health is relatable. That makes a lot of sense, that people can think about a virus and imagine it as something that you can try to treat in some way. You might go to the doctor for a virus. It's something that can be passed from person to person. Everybody experiences a virus at some point. And so therefore, a virus metaphor seems more relevant to folks, whereas a beast sounds like a fantastical creature, something that most people are unlikely to run into. Anything else, Jess?
We've got a couple comments along the lines of a virus is something that can spread, can be contagious, and we have no control over a wild beast, but a virus can be defeated.
Yes. Okay, so we have all these systems and structures in place to help us deal with a virus. We've got the Centers for Disease Control, we have hospitals, the entire medical profession, we have lots of ways, public health departments, we have lots of ways to try to contain a virus and control it. But a beast is wild, it's unpredictable, it's scary. So there are lots of ways in which one metaphor drives people towards solutions, and you can see that their mind is working towards solutions and the belief that solutions exist by the drastic increase in the support for policy reform that the virus metaphor yields compared to the level of support that the beast metaphor yields. So that's how understanding can be influenced by the framing strategy that you choose. So it's important to remember that. And the third thing you need to remember about framing is that our brains are funny creatures. They're not logical. And so some of the strategies that intuitively sound like a good idea, if you're an advocate or a communicator trying to help people see things the way you do as an expert on the issue, actually can backfire because our brains don't work in the ways we tend to assume they do. So let me walk you through a few strategies that people often turn to as communicators, as advocates, but that we know from research really don't work as well as we tend to think they do. So here's the first one, that order matters. Often it's a really common strategy across just about every social issue we work on to create myth fact sheets. And I'm going to stop here and confess to you that before I joined Frameworks, I wrote misfact sheets all the time. I worked in labor organizing and higher education, and I thought misfact sheets were the best way to help people understand the things that they'd gotten wrong and to correct their perceptions about issues on things that we needed them to understand. Well, it turns out there's a lot of research that shows that repeating the things that you don't want people to remember is a bad idea. So let me give you a quick example of that research. A few years ago, a team of researchers shared a flyer that the CDC had produced on the flu vaccine. And in that flyer, it said things like, myth, the flu isn't a serious disease. Fact, the flu is a serious disease. Myth, the flu shot can cause the flu. Fact, the flu shot cannot cause the flu. And then the researchers asked people to respond to a series of questions testing what they knew about the flu shot after having read the flyer. And they found a few things, none of which were particularly helpful to spreading proper information about the flu. First, they found that people misremembered the myths as true. Then they found that their memories got worse over time. And so they brought them back a few weeks later, asked them the same questions, and found that more of the people misremembered more of the myths as true. And then worst of all, they found that the CDC, they attributed the false information to the CDC. And so now we had a bunch of folks walking around thinking that, I don't have to get a flu shot because the CDC says it's not that big a deal, which of course is the exact opposite of what this says. And we see this type of communication happen across issue areas. So a good rule of thumb is if you don't believe it, don't repeat it. Another strategy that advocates often turn to try to steer their way out of people's assumptions about an issue is to use a lot of data and to rely on data to tell their story. But facts and numbers really don't speak for themselves, and especially in the context of sharing information with a non-expert public, what you'll find is that people are likely to misinterpret numbers in all kinds of ways that you can't predict until it's happened. So just assuming that numbers will do the job for you is not a good framing strategy. And then finally, probably the thing that we see most in communications, in advocacy communications, is this idea that if you just yell fire in a crowded theater, you'll get people's attention. Well, you might actually in a crowded theater get people's attention, but in a crisis communication, you're less likely to get people's attention because everyone is yelling crisis about all of their issues. And the problem with yelling crisis to try to compel people's attention and get them to act on your issue when you're in a crowded field of lots of issues and lots of demands on people's attention is that we all have a finite amount of worry that we can devote to any particular thing. And every time someone receives a crisis communication, you're siphoning off a little bit more from that pool of worry until eventually it runs dry. There's a lot of research to show that emphasizing urgency or crisis, if you're not coupling it with strong solutions and a sense of optimism about our ability to solve a problem, actually depresses people's support for an issue. They feel overwhelmed and they disengage and they walk away. So it sounds intuitively like a good idea, but our brains reject that. When we see crisis messaging, we tend to walk in the other direction. Okay, so instead, what we want you to remember about framing is that you can make really good, effective communications choices by doing three things. The first is to have a good grasp of what cultural models or what assumptions people are using to reason about your issues. So what are the things that they already understand or think they understand? What stories are they already hearing? And which of those are helpful to you and which of those are unhelpful? So the second thing is to identify which of the, once you have a good understanding of where the public is on your issue, to understand which of those assumptions they bring to bear are most helpful for you to use in making your case, and then to choose cues. And when I say cues, I mean words, phrases, images, messengers, values, metaphors that can call up and steer towards the most productive assumptions that people have about the issue, and also keep you away from activating their less productive assumptions. So let's spend a little bit of time thinking about what public perceptions exist around children's mental health. And I'll stop here. Does anyone have any questions for me so far? If you do, go ahead and enter in the chat box, and Jess will let me know. But in the meantime, I want to walk you through Framework's research on children's mental health. And when I'm talking about our research, what I mean in this instance is that we interviewed a diverse set of people all around the country and sat down with them for one-on-ones between a researcher and a research participant. And it was a long-form interview. So this is a 2 to 3 hour long interview where we are just asking people to open-ended questions to get them to download for us everything they know or think they understand about a particular social issue, in this case children's mental health. We record those conversations, and then we transcribe them, and then we analyze and use special coding software to identify the patterns that emerge in the ways this diverse group of people think and talk about a particular social issue. And then these long-form interviews are backed up by what we call on-the-street interviews, which is exactly what they are what they sound like. We go out on the street around the country and ask people to go on camera and talk with us for a few minutes, shorter interviews, 10 to 20 minutes, about what they understand about the issue, and make sure that what we've found in this diverse set of long-form interviews is reflective of, is reconciled to what we hear in on-the-street interviews too. So by the time we're done, we have a really robust sample of people and how they're thinking about the issue. And here's what we found when we did this work on children's mental health. First, we found that often people said, well, kids don't have mental health. They don't have the emotional capacity to have mental health. Their memories don't start until they're age 5, so very young children don't have mental health. So that was one model we had for having people think about mental health. They said, well, I know nothing about children's mental health, didn't know they even had it. When we got people to think about the fact that children do have mental health, they defaulted to the idea that kids are little adults. They're similar to adults, but just a little less complicated, and therefore treatments for any mental health issues or challenges or mental illness that arose would be the same as it is for adults. Which, if you're a communicator and you want people to understand why we need to have these kinds of interventions, or why this works for children and that doesn't work for children, if people are reasoning from the idea that kids just need the same treatment as adults, it's harder then for you to build support for specific programs that address children's special needs. There's a strong belief in American society that mental illness is about chemical imbalance, which, as you know, is just it's one part of a much larger story. And in thinking about that, what we heard people say again and again is that mental illness is genetic, and because most people don't have a good grasp of how genetics works, they believe that to mean that your genes are set in stone, and therefore mental illness is it's fated, essentially. It's in your genes, and you can't do anything about your genes, and therefore you're born with it, and there's nothing you can do about it. The only thing that we might be able to do about it is treat it with drugs. So there's a very limited understanding of how mental illness works, what causes it, how genes interact with environments, and how social environments can determine and contribute to outcomes. If people are reasoning from this way of thinking about mental health and mental illness, that there's nothing we can do about our genetics and only drugs are the treatment, then that also limits their ability to understand an enormous array of interventions and solutions that are available for dealing with mental health and addressing it in ways that can yield us good outcomes. There are some interesting things in this ecosystem of the ways we think about child mental health, some productive ideas. Remember I mentioned there are both productive and less productive ideas. One of them is that people do have a good sense that environments matter. It's just that understanding that, okay, the context in which you grow up and the social environment in which you grow up could have an influence on your health and your mental health. That's less dominant than the idea that kids don't have mental health or that mental illness is about chemical imbalance. So the idea that environments matter is there, it's just really buried. So as a communicator, what that means is that to help people think more expansively about what it means to shape environments to provide programmatic supports and to have policy solutions put in place and to make sure children and families can access health care and mental health care when they need it, where they need it. All of those things become harder to make a case for when people are thinking instead that kids don't have mental health or it all starts in the home. But if you can get them reasoning from the understanding that environments do matter, then you have a much better shot as an advocate in moving their support for the kinds of solutions that all of you are working towards. There's a lot of confusion among members of the public about exactly what mental health is. And the default assumption is that mental health it's about emotions. It's about controlling your emotions. It's about being happy and just learning to be happy. And if you fake it till you make it. If you feel sad, you can just shake it off and pretend to be happy, and eventually you'll be happy. So there's a lot of misunderstanding about how mental health works. And then finally, there is an understanding that good mental health is the ability to function normally, but that's a pretty limited way of thinking about what mental health is. So the idea that as long as you can get to school and your grades don't suffer, then your mental health must be fine is a very limiting way of thinking about it. Yes, functioning is really important, but it's one piece of the puzzle. So these are some of the assumptions and perceptions the American public has. We think about it as an ecosystem to remind ourselves that people's brains aren't empty fish bowls. When you send a message out into the world, it's not landing in a vacuum where it gets to be safe and sound and interpreted without any other noise getting in the way. Instead, our brains are already full of lots of different ways of thinking about an issue, and your message is entering that space where there are other contesting, contradictory assumptions and perceptions that are already deeply rooted in people's minds. And so you've got to find a way to create a message that activates the most helpful of those deeply rooted ideas and steers clear of the least helpful of those ideas. Now take one good look at this, because what I'm going to do next is walk you through a game in which I'm going to, if you imagine this as like the forest of our minds, I'm going to walk you through a game in which we drop a real advocacy message into this forest of lots of different ways of thinking about the issue and see how it will fare. So is there a bear that's going to eat this message, like the bear that children are little adults or that kids don't have mental health? Or is there something positive that's going to show up, like a firefly of understanding based on what cues, language, word choices, tone are in that message? Let me know if you have any questions. Here we go. I'll drop this message into that forest of public perception. Take a moment to read this. Okay, so in this message, it's a real advocacy message, what do you see in here that might cause, like it might activate some of the less productive assumptions people have about children's mental health? Are there word cues in here that might be unintentionally unhelpful to the author's intention.
We've got some comments coming in. Kill is the first word. A couple people are saying kill.
Okay, so using the verb, so why young children kill themselves. Okay, so that maybe leads to, feeds people's misunderstanding about how suicide works or how professionals, experts talk about it. Anything else? When you say young children kill themselves, it places responsibility on the children, right? Sort of, there's an attribution of responsibility there that suggests it doesn't help people see the bigger context in which children may become victims of suicide.
Several people are pointing to the language of blacks in general, African Americans, blacks versus whites.
Yes. Okay. So there's a lot of information here that doesn't seem to have any particularly helpful context. So the paragraph that's 4 out of 10 suicides involving children aged 5 to 11 were black children, mostly boys. But then it goes on to say they don't know why. Generally, this is an aberration from the norm. And then that's followed up with a paragraph that says that's about mental health problems and attention deficit hyperactivity disorder. So these paragraphs invite people to fill in what's missing in information here with their own assumptions. And those assumptions, you don't know where they're coming from. So people can fill in their assumptions about different populations and say, oh, well, this group is like this, and therefore I can explain away in my head why this number is what it is. Or, oh, it's because of ADHD, and therefore you can't do anything. You know, ADHD is not a public problem. That's something that parents and kids themselves have to deal with. They should talk to their doctor. So there's a lot in here that seems to be leaving gaps for people to fill in with whatever assumptions they have themselves. Anything else?
A couple people have pointed to that word impulsive and the implication that suicide among folks who have ADHD is attributed to their impulsiveness.
Yes, exactly. So it's about people making bad choices. So if you're an impulsive person, it means, oh, I shouldn't have spent that money. I just don't have enough willpower. And you can read that then to suggest that, well, these people just made bad choices. These kids just made bad choices. And again, if we are thinking about solutions, what is the solution to someone who's made a bad choice? The solution is for that person to make a better choice. So there's no room in there for people to think about policies and programs and public support and access to mental health care and early interventions and screenings, all the kinds of things that you all work very hard to make sure children have access to are absent from this message, even though this message was written by an advocate who's looking for solutions to lower these rates. These are numbers that they want people to understand are bad and need to be addressed. But all of the cues chosen in here don't help the reading audience understand that, the public to get that. One last thing I'll mention before we move to the next example is that there's a lot of numbers in here too. There's a lot of data, and this data doesn't necessarily help build people's understanding. An example of cause and effect. So children, what kinds of things in a child's environment, what lack of screening or what kind of screening could have helped or the lack of it didn't help, things like that would be a lot better in terms of helping people understand what some of these numbers mean. You can't rely on the numbers to tell the story. Okay, let's try one more example. I'll give you just a moment to read this. And when you're done reading, if you see cues in here you want to point us to as unhelpful word choices or ways of explaining that might activate some unproductive assumptions, go ahead and put those in your chat box. So one of the things that I see here, the overriding challenge I see here, is that this message really says mental health is about you personally doing things to help you have good mental health. And there's not a lot of room here for people to think about how schools, for example, have a role in helping to reduce back-to-school anxiety for children, whether that's building in counselors or the ways students are greeted or making sure that children have access to interventions. Instead, it's the back-to-school essentials list. It's about organizing and easing nerves, which doesn't account for the wide array of mental health challenges that children can face. It just suggests, again, that it's just all about controlling your emotions, and here's a helpful checklist to help you control your emotions. So this post doesn't do much to help expand people's understanding of what mental health is, how it happens, and all the many players that go into making mental health a reality for children. Is there anything in the chat box? Okay. Any questions about that? Okay. So the takeaway here is that while we all know that storytelling is really important and it's a helpful way to communicate, to tell a story, the important thing, the question that strategic framers ask themselves is, what will that story do? Okay, what will the effects of this word choice be over that word choice? Or if I use this messenger instead of that messenger, will that make a difference in how my audience hears what I'm saying? Am I using numbers that don't make sense to a non-expert audience? Am I unintentionally placing responsibility for mental health squarely on the shoulders of the people experiencing mental health challenges? Or am I making sure people understand, whoever my audience is, that we all need supports and resources to support our mental health? Okay, so what we did after this work, what we call our cultural models research, was to, once we had a sense of where the public is compared to where experts and advocates are in their understanding of children's mental health, that's when we set to work coming up with strategies to help you communicate more effectively about children's mental health. So strategies that that can help you steer towards the most productive of some of those assumptions that we talked about, that environments matter, for example. The first strategy I want to share with you is a value. And when I talk about values, I'm talking about cherished ideals or beliefs that we all have in a culture that help us think about the world around us. So the values that we use to make sense of the world around us. And in strategic framing, the goal is to use values appeals that tap into positive, efficacious emotions. So the idea, like you want to appeal to people and reach them, engage with them through an appeal to a shared value that gives them a sense of can-do, or the idea that there are solutions available to us. It's a way of priming your audience. You know how you have to prime a mower? I don't know, did you still have to prime mowers? Well, I used to when I was a kid. I always have to prime a gas mower, and once you primed it, you could get it to start. So you're kind of helping start your audience's engine with the value. That's why they tend to go well at the start of a message, because it sets you up for the rest of the conversation and unlocks a certain way of thinking about the issue that's positive, that engages them, that helps them understand what's at stake for them in addressing the issue. But the problem is there are all kinds of values available, everything from world peace to cost effectiveness to progress to responsible stewardship to love. So like, what's the value you're supposed to choose? And Frameworks does the research to figure out what value actually works best to help build people's support for and understanding of children's mental health issues. We do this in through an experimental survey design that helps us see what's going to work on a particular issue. So I'll walk you through what this survey looks like. The survey experiments that we do are between 3,000 and 8,000 people in terms of sample size. So it's a nationally representative sample. And we get this sample size and we randomly assign folks to a treatment group. So for example, someone might log on and they're in group A and they get a little, what seems like a newspaper article framed with a particular value, say interdependence, the idea that what affects you affects me, what affects me affects you, and it's all about children's mental health, but it's framed with that value of interdependence. And then someone else logs on and they're in group B and they get a message about children's mental health, but it's framed in the context of ingenuity. So we're creative and resourceful and we can fix this problem. And a third person logs on and they're randomly assigned to group C and they get a message of empathy. So aren't you, what if this happened to your loved one? Wouldn't you want them to have access to mental health care? So they get that message. And then a fourth group logs on and they get no message at all because they're the control group. And what we're going to do once everybody gets randomly assigned to a treatment group is ask them, after they've read their little short story framed with the value that we're testing, we're going to ask them questions that measure their attitudes about children's mental health, their knowledge about it after having read that short paragraph, and their support for the kinds of policies that advocates and experts want to see adopted to improve children's mental health outcomes. And we do that on what we call a Likert scale. So a 7-point Likert scale. You read a statement and you indicate whether you strongly agree or disagree and so on. And then we analyze the results to see which exposure to which value actually moved people the most in terms of their attitudes and knowledge and policy support in the direction that experts want them to go. And we control for demographic variability there to make sure that the value is working across groups and that it's not just working for one particular group. The idea here is that we want to find the framing strategy that's going to work for the biggest group of people, the biggest swath of the population, and really cut through all of our differences to zero in on a framing strategy that can engage all of us, or as many of us as possible. So here's the value that we found when we did this research for children's mental health. The value of ingenuity, it turns out, is the one that best moved people's support for children's mental health policies and programs. And the idea behind this value is a message of resourcefulness. We can find innovative solutions. We can work together to support children's mental health. So if you think about it, Americans as a community are we're very resourceful, can-do folks. So, as soon as the river's rising, neighbors come together to figure out how we're going to get those sandbags made so we can stop the river from overflowing its banks. Right? We're always coming up with new inventions. So ingenuity is a value that, in this issue, works really well and taps into a deep emotion that the public shares, even despite all of our differences. It works really well because it moves people away from their presumption that damage done is damage done. So, oh, well, someone has a mental health challenge and there's really nothing we can do about it, feeling very fatalistic, or all they can do is make a choice to be healthy and I can't help them with that choice. Instead, ingenuity really gets people thinking about how can we fix this problem? What are the social solutions here that could make for a better outcome? And so it moves people towards a better sense of agency and really taps into their beliefs that we can solve even difficult or long-standing challenges. I'm going to give you an example of what it looks like to use a message of ingenuity in a communication. So what you see on the green screen right now is a real piece of communication that was put out about children's health and mental health outcomes. I'll give you just a moment to read that, and then I'll show you on the blue side what it would look like to take that message and reframe it using an ingenuity appeal. Okay, so notice on the green side, it just jumps right into the problem. Research shows that child maltreatment is associated with adverse health and mental health outcomes, and goes on from there, and then it has a long list of all the actors who are affected by this and the terrible costs of child maltreatment. So it's very much a list that we jump right into the problem, and then we keep hammering on what that problem is. Here's what it is to talk about that same issue, but using an ingenuity value. Instead of jumping into the problem, which is all the research showing that maltreatment is associated with bad mental health outcomes and so on, we back up a little bit and we start with an appeal to ingenuity. Remember, this is priming people's thinking engines. So we start with the U.S. has a long history of overcoming difficult problems, and child maltreatment needs the same problem-solving attention. So you've captured people's attention by tapping into something they believe in, the sense of like, yes, we can solve problems, and then, excuse me, go into what the problem is. If we don't address this problem, child abuse and neglect can affect children's mental and physical health for a lifetime, and also it puts a strain on these other services. But there are some solutions. For example, integrating the expertise of judicial, public service, and nonprofit agencies can expand the use of solutions that can benefit our children and our communities. And we can continue to invest in high-quality solutions to maltreatment in order to generate fixes that can save us $258 million a day. So even notice at the end the way data is used. On the green side, it's about how child maltreatment costs the nation as much as $258 million a day. On the blue side, because one of our goals is to defeat the fatalism people bring to talking about social issues, you have to help people understand that there's something that we as a community, as a society, can do about this issue. You flip it to talk about what can happen, what are the positives. So instead of this is a drain on our economy, it's, hey, we have the opportunity here to save our nation this much a day, this much a day if we invest in solutions for children. So there's a difference here that changes the framing strategy, even though the message is the same. It's the very same content, just reframed with a different value. So it's time for a quiz. Let's see if I've done my job here. In the three examples in front of you, which statement best represents a good use of the value of ingenuity? I'll give you a moment to think about that. You can put your answer in the chat box. If I'd thought about it sooner, I would have had the little like Jeopardy music playing while you wrote out your answer. We have a lot of, what have we got a lot of, Josh?
We've got a lot of C's coming in.
All
C's so far.
All C's. Excellent. Okay, so, Smarty Pants, you're right, it is C. But why is it C? What's wrong with A? Why isn't A a good use of the ingenuity value? What's the plural of Smarty Pants? That's going to be plaguing me now. Is it Smarty Pantses? I'm not sure. I don't think I've ever had the opportunity to call multiple people Smarty Pants at once. Does anyone have thoughts on why it's not A?
We have someone who says we need to learn, not just the children.
Yes.
It's all on the child.
Yeah, that's right. This puts it all in the child. Children can learn to manage their emotions if we, with resourcefulness and creative problem solving. But that just reinforces people's perception that it's all about kids having willpower to control their emotions. Very good. What about B? Why isn't it B?
We're doomed. Doomsday messages. Doom, and gloom.
Yeah, it's all doomed. Yes, doomed. So it's very the word doomed. We better get busy. If we don't start doing this soon, it's very crisis oriented. And as we know, crisis just really turns people off and causes them to disengage. So that leaves us with C, which builds a sense of optimism that we can address this problem just like we've tackled other problems before successfully. Wonderful. Any questions on ingenuity before we move on? Okay. So let's talk about metaphor. I think in the March 20th webinar, Jess introduced this as one other framing example. We just talked about metaphor and how it can work on our minds earlier in this webinar when we talked about the virus versus the beast example. Metaphors are helpful because they can take something that's really common and familiar to people and map it onto something that's unfamiliar in order to help them understand it better. So, for example, I'm not a neuroscientist. I don't understand anything about brain development, but I studied English in college, which means I read The Three Little Pigs, and I know something about how you build a house, right? What do you build a house out of, and how does that make for a strong structure? And so because I know so much about building houses, even though I've never actually built one, it can help me think about brain development differently. So I can understand that when you're building a house, the first thing you lay is the foundation, and the foundation has to be strong for the house to be strong. That helps me understand when a neuroscientist or a child psychologist says to me that the very first thing, very earliest years of life in a child's life are the foundation for everything that comes after it. If kids have a strong foundation in their first years, then they are likelier to have better life outcomes overall because you're helping develop their resilience and so on. I understand that the quality of the materials you use to build a house makes a difference in how strong the house is. So, you know, the house made out of bricks doesn't get blown down by the wolf. In the same way, I understand that if children don't have the nutrition they need, the access to loving and stable care, to safe housing, to health care, and so on, all of the materials that go into building this early foundation, then they also are at risk of having problems later in life. So there are ways that I can take this really common image. Everybody knows something about building houses, even if the majority of us never have, and we can map it onto what we understand or what we don't understand about brain development, and it helps us understand it better. So we have a lot of ways of testing metaphors, but this is a quick overview of that. We take the metaphors we want to test and put them out on the street first. So we interview folks on the street and ask them to think and talk with the metaphor and see if they're able to understand a concept, in this case children's mental health, with the metaphor that we're offering them, and if they can talk about children's mental health and it seems to improve their understanding of it. Things that work there, metaphors that work well there, then go on to an experimental survey that looks a lot like the one I just described with the ingenuity value. And then the metaphors that survive that round of testing go on to what we call persistence trials, which is like a game of telephone. It's where we're testing the ability of the metaphor to move from person to person to person without falling apart. And that lets us know how strong it will be when it goes out into the media, into public conversation and dialogue, and whether it will withstand that challenge. And then finally, if it matches, if it works in the persistence trials, we move on to the usability match trials, and that's where we take the metaphor and we go back to the experts we worked with at the start to identify some of the communications challenges and ask them if they can use the metaphor to think and talk about the social issues that they're working on without the metaphor in any way compromising their message. And if they're able to use it in their communications, that's when we figure we've got an effective explanatory metaphor, and that's when we release it and start sharing it with members of the field. So here's the metaphor that we developed for talking about children's mental health. It's the idea that children's mental health is like the levelness of a table. And just as a table isn't functional if it isn't level, if children are experiencing mental health challenges, they're unable to function well in other areas of life. So it helps people understand that mental health supports children's overall functioning and development. But it also helps people understand that there are social and environmental factors that can get in the way. It's not just all about what's going on inside the children. Sometimes there are environmental determinants that influence how a child is doing. So if you have an uneven table or a wobbly table, sometimes it's because the leg on that table is wobbly, but sometimes it's because that table is sitting on an uneven floor. And you can fix the floor or you can fix the table. But it's important to remember that tables can't fix themselves. And knowing that piece of the metaphor, or what we call an entailment or an association, that really helps people understand that that mental health is about so much more than just asking children to control their emotions. You can also use the metaphor to talk about how, if the table is wobbly, you can fix it right off the bat. You can have an early intervention and fix the problem easily. But if it gets worse and worse and worse, and the table starts breaking down, or the floor gets more and more rickety underneath the table legs, you're going to have a more expensive repair on your hands. That helps people understand why earlier intervention is helpful. So there are lots of different ways that you can use this metaphor to talk about and build, to talk about children's mental health and build people's understanding of the complexities of it that are lost on people who aren't experts. But you can help build their expert understanding through this metaphor. I want to tell you a quick story. Shortly after we had developed this metaphor, a few years ago, a woman who's an advocate in Illinois reached out to us. She sent us an email just out of the blue. We hadn't met her before. We didn't know her. But she had found our report on this online. And she happened to be giving a talk on children's mental health at some big function. Well, she got there early to set up. And she went around the room and messed with the legs on every table so that they were all wobbly. So people came into the room for this event and sat down and were waiting for her talk to start. And she came out and said, so did anybody notice that your table was a little wobbly when you sat down tonight for dinner? And then everybody in the room raised their hands. And she said, and did anybody fix it? And again, all these hands went up. People had already shoved a matchbook or folded a piece of paper or something under the table because it was so annoying. It was so, it made them unable to, it was distracting them from their purpose, which was to network and have dinner and listen to the speaker. They had to address it. So she used that as an example and then launched into how children's mental health is like the levelness of a table, which I thought was a really, really creative use of the metaphor. You can hear, this is just a quick, let me play this for you. This is a quick video that was created with the Harvard Center that explains the metaphor so you can hear it being drawn out just a bit. It's a short clip.
Of stability for a child's development. Mental health problems can be thought of like a wobbly table. With a child or a table, there may be many reasons for instability. Identifying which factor is causing instability is the first step towards solving the problem.
So it goes on from there. It's part of a longer video that is talking about the core story of child development, which walks you through how to use brain architecture and toxic stress and some of the other early childhood development strategies we've developed, but also levelness, our children's mental health metaphor. So we're back to an advocacy message. Again, you'll see on the green side an example of an original message. and then we'll show you how we helped to reframe the message using the levelness metaphor. I'll give you just a moment to read the green side. So, generally speaking, this is a pretty decent message. There's nothing here that is noticeably unproductive. There are no crisis cues, for example. It's got a reasonable tone. It explains things a bit. But if you're communicating with a public that really doesn't have any deep sense of what children's mental health is, or even that children have mental health, the metaphor can really help you help your audience think more tangibly about these issues and give them a visual to hold on to. Metaphor works because it helps people understand process. And what you don't see here, so in the quote, for example, it says, it's during childhood and adolescence where we have a large concentration of mental health issues, schools where many kids are spending a large portion of their day, so therefore school is the perfect place to focus on mental health resources. But there's not a lot here to help people understand the process. What does that look like in practice? So the metaphor can help you give people something to hang their understanding on. It's what we call sticky or concrete, and a visual that can help them piece together the information that's being delivered. So same opening largely, except that instead of play a key role in mitigating negative consequences later in life, we've changed it to can help them maintain stability later in life. So you're setting up the metaphor with that idea of stability. And then it's during childhood and adolescence. So again, the same in the second paragraph, it's the same quote until we get to the second half of the sentence. Large concentration of mental health issues, which act like cracks in the floorboards underneath kids' feet and put a wobble in students' desks. So instead of leaving your audience to try to figure out what do you mean by a concentration of mental health issues and what does that have to do with school? Because school is one thing and then mental health happens at home. It's all about parents and kids. So why are those two things related? But suddenly with this image you can imagine being in a school that's falling down around you and how that's a problem. And the environment you're in can be a problem. Okay, and so then down below the very last paragraph, by filling in the cracks, repairing any shaky legs, we can help all students maintain levelness and ensure that our learning environments support good mental health. Again, this is about giving people a sense of optimism. Paying attention to student mental health leads to school dropouts. That's the green side. That's really a very fatalistic way of talking about children's mental health. Doesn't help people see what the solutions are, and again, suggests, well, dropouts, I mean, that's a child's choice if they want to drop out of high school. But instead, in the second version, the metaphor helps you talk about solutions and helps, without going into the deep weeds of what those solutions look like in practice, it gives people some tangible way of visualizing what those solutions might be. In a longer quote, you could start giving examples of what does it mean to fill in the cracks, or what does it mean to repair any shaky legs. Maybe it's counseling services, or etc. There we go. So you can just see here with the yellow lines where the metaphor comes in. One thing I want to note about using metaphors in your communications is that they're not magic bullets. So just dropping the word levelness into a communication isn't going to get you the same kind of framing effect that building the metaphor out and really letting it breathe and come to life in your communication is going to get you. So here people have three or four what we call doses of the metaphor, and that's going to help really put it in their minds, keep it in their memories, and drill down into their memories so that the next time they encounter a message about children's mental health, that metaphor is more likely to be present in their minds because they've had repeat exposures to it. So framing is about finding the right cues, but it's also about using them often enough to help build an understanding using those framing cues so people recognize them again and again and again. So repetition is really key here. Okay, so let's do a practice exercise. What I want you to do is think about the many different ways that you could use levelness in your communications. So think about what words come to mind when you consider the concept of levelness, so you can be as creative as you want to be. I just want you to think about what sorts of language cues you could build into your messages. I've got a few examples here, like stable, slide, uneven. What are some other synonyms you can think of, or images that you can think of that you could use in your own communications?
We've got the word equality.
Equality. How does equality convey the idea of levelness when we're thinking about mental health? I appreciate equality and levelness, like the levelness of the playing field, for example. But the metaphor here is really about focusing. We have other research for talking specifically about equity. So I need to think about that one.
So folks are diving into the topic a little bit and talking about opportunities for children, inclusion, environmental impacts. Here we've got some kind of broader brainstorms of the metaphor, unsteady, rickety.
Oh yeah, unsteady, rickety, those are ways that you can talk about the effects of untreated mental health challenges, or what can happen when the table's not level or when the floor is not level.
Firm levelness is pleasant. You can have a nice dinner. When things wobble, things fall off the table and break.
Yeah, that's great. So that's fantastic. When things wobble, things fall off the table and break. It's pleasant, it's nice, and you have a firm, solid table. That's great. So there are a lot of different ways you can play with this in your communications. You can use it in subtle ways. You can use it in really overt ways. You can have images of a table or something, or the image of a level. So there's a lot of room for creativity here. I want to summarize some of the things that we've covered here and then give you a chance for questions. And on the screen you'll see a set of things to avoid and a set of ideas to advance. So often what we see in communications about children's mental health is this idea that we've got to help vulnerable kids. And I understand that as experts and advocates, this is coming from a place near and dear to you, that your hearts go out to the children that you're helping. That's not necessarily the message that will help the public follow along with you to understand why we need support, why we need to support children's mental health through better programs, well-funded programs, and policies that make sure everyone has access to mental health care and so on. Instead, the value that you should be advancing is the idea of ingenuity, or that we can find solutions. We saw in the in those green slides that we looked at, where we dropped a message into the forest of people's perceptions, we saw where things can go off track if you assume too much about your audience's knowledge base and leave them to fill in some of the knowledge gaps on their own. So instead, it's really important to focus on explanation, and you can use a levelness metaphor to help you explain children's mental health. Focusing only on mental illness really helps people, it reinforces the assumption that mental health is only about when things have gone bad and how you have to regain control, but instead try to push forward a vision of what good mental health looks like. It's something that the public has trouble understanding or envisioning. If you really focus on children's emotions and behaviors, you're limiting people's understanding of how protective and risk factors work. So wherever you can advance those ideas of protective and risk factors, like increasing protective factors reducing risk factors, it can help expand people's understanding of the social determinants of mental health. And then avoid that crisis framing. If it's if your whole message is about the problem and the solutions are on page 49, that's not helpful to people's understanding of what it is we can do. And if people feel like there's nothing we can do or the solution is buried, they're going to disengage and not come along with you for the long term. So when you mention, it's important to understand a problem so you can understand why the solution is necessary, but balance those things out. Explain your problem, but match your problem with the solution every chance you get. So I'll ask if there are questions. If there are questions, go ahead and put them in the chat box, and we'll get to those. But I also want to invite you to take a framing challenge before the May webinar, which is on May 7th. This is a challenge. I want you to look through your communications materials or maybe a favorite talking point, something that you say a lot about children's mental health, and identify one unhelpful framing cue that you're using that you're going to stop using. Okay, so it might be that you rely on crisis too much or that you love to fill your communications with data. Think about one thing that you're doing right now and what you can try to stop doing. And then think about what strategy is going to replace it. So if you're taking something out of your communications, what are you going to put in instead? And be prepared for the next webinar to share what you did and how it went. So we'll kick things off that way. In the meantime, if you're on the Learning Management System looking at this course and other materials that are up there, we'll see if we can get a chat forum going on that too, so you can post your responses there if you like as well. Are there any questions, Jess, in the chat box?
No questions yet, although it looks like a few of you are starting to type some in. Someone just offered the kind of summary comment that this is a solutions-oriented approach to addressing mental illness.
Yes, very solutions-oriented. The public really has a hard time. No, because if you don't understand what the problem is, you really can't understand what the solutions are. So if your understanding of the problem is that mental health is about controlling your emotions, it's really hard to understand why early intervention programs at schools make a lot of sense, or screening of very young kids. So yeah, focusing on solutions and helping people understand what the right solutions are is really important for helping build people's understanding.
So we do have a good question here. The question is, are you okay with us borrowing these metaphors for our own materials?
100%, 110%. These materials, the metaphors, they're all there for you to use in your communications. So Frameworks does this research. We're typically funded by a foundation or something like the Harvard Center on the Developing Child, for example, to do this communications research to find the framing strategies that work. And then we make those available to everybody working in a field to use for your communications. So we have more resources online. You can read the reports that all this research comes from online. None of it is behind a paywall. It's there for you to use. And if you have questions, you're more than welcome to get in touch with me or Jess, and we'll be happy to walk you through some of those materials.
We have another question here about if these strategies work for helping parents who may not understand what mental health is or how it works.
Yes, that's a great question, and they do work and they work in part because the strategies are designed to work on the public generally, and parents are members of the public just as much as they are parents. So we have a lot of direct service providers and clinicians who use these metaphors in communicating directly with families about these issues. Anything else?
Well, it looks like there's a bit more typing going on. Lots of thanks to you, Jen.
Oh, good. Well, I'm going to turn it back to Michelle to walk us through a couple of final slides, including this reminder of our next webinar, which is Tuesday, May 7th, 3 o'clock. Michelle, back to you.
Thank you so much, Jen. That was fantastic.